So beginning in the 80s and accelerating in the 90s and really accelerating in the aughts, the number of people with employment-based coverage began to fall, not even rise. Even as the population and the workforce got bigger, the number of people with employment coverage went down. At the same time, the cost of health care went up, so that you had fewer people with employment-based coverage, and you had many more people with inadequate coverage. And this chart just shows the number of people who are uninsured. The bottom part of this shows the number of people who are uninsured. And it's the darker part at the top are people who were spending more than 10% of their income to get health insurance, either by co-premium with their employer or to buy it for themselves. And the bottom part are the people who had nothing. And in the last decade, the number of people with employment-based coverage has fallen by 10 million, and not coincidentally, the number of people with without coverage at all, even despite the increase in Medicaid, which grew, and child health, S-CHIP, which was made a significant impact on kids. The number of people without coverage grew by 10 million. Same number. Probably not a coincidence. Not correlated directly, but pretty well established. So I thought I'd show you, before we get to the Affordable Care Act, just a little bit about one of its principal architects, who's a man I admire greatly. So he happens to be running for governor of Massachusetts. So if actually you live in Massachusetts, I'd urge you to support him. But that's not the reason why his picture is here. His picture is here. His name is Don Berwick. And he was the founder of something called the Institute for Healthcare Improvement. And he was nominated by President Obama to be the head of the Centers for Medicaid and Medicare Services, which is the principal part of HHS, where the Affordable Care Act is being administered. The minute his name surfaced, there were lots and lots of complaints from the Senate, and they said his appointment would never come to a vote. And there were two reasons, principally. And I'll let you guess what those reasons are as I show you two quotes from Dr. Berwick that were dragged out and prominently displayed as to the evidence of why he could not possibly be the administrator. Here's the first. That's very small. It says, the decision is not whether or not we will ration care. The decision is whether we will ration it with our eyes open. Second quote, any healthcare funding plan that is just, equitable, civilized, and humane must redistribute wealth from the richer among us to the poorer and the less fortunate. Excellent healthcare is by definition redistributional. And the third, I am romantic about the National Health Service. He's talking about the British National Health Service. I love it. Berwick said during a 2008 speech to British physicians, going on to call it generous, hopeful, confident, joyous, and just. He compared the wonders of British healthcare to U.S. system that he described as trapped in the darkness of private enterprise. So this is the guy that the president nominated to be basically the administrator and the architect of the Affordable Care Act. He had much to do with its design. He never came to a vote in the Senate. He was a recess appointment, and his term lasted just as long as it could, constitutionally, as a recess appointment, something actually that the Supreme Court is now considering. I'll come back to Dr. Berwick's diagnosis. DX means diagnosis a little bit later. So what's in the ACA? Essentially, there are two pieces. One is coverage expansion, and you guys probably know this. The coverage expansion, the expected expansion of coverage to about 30 million people, half through Medicaid expansion and half through the exchanges. And that's estimated to cost $1 trillion over 10 years, which is a lot of money, but it's not a lot of money when you consider that we're approaching $3 trillion at the moment in 1 year. And we can talk about those details a little bit later, but one other piece of this that's overlooked, and I think probably as important as the coverage expansion, is the regulation of the insurance industry, which has significant impact on who gets insurance and why. And if you look at the next slide, there's a guy who's very obsessive, who has a website called ACA Net. If you go to his website, day by day, he's charting enrollment. What's interesting about this chart is that it's not just about enrollment since October in the Affordable Care Act. It also shows you the growth in Medicaid enrollment, even though many states are not participating. And it shows you a couple other things that the Affordable Care Act has an impact on, not the least of which is a large group of young people who continued in benefits as a result of the ACA because they're on their parents' plans. They're 26 or younger. And the second significant point, and there's also some private expansion of private coverage, because one of the pieces of the ACA and the regulation of the insurance industry said that insurance companies may not deny coverage based on medical underwriting. You can't be denied coverage because you're sick. Now, New York has had a law that did that. That law called Community Rating Law, that went into effect in 1996. And when that law went into effect, we had 300,000 people in New York who bought their own insurance coverage. And when the law said that, insurance companies could no longer deny coverage to New Yorkers who were ill, the number of people who bought their own insurance began to plummet. And the reason why that happened, it's a little bit counterintuitive, but it's actually an important point, is because if the insurance companies were not allowed to prevent people from buying coverage, it meant more sick people were going to be in the pool, because the people most likely to buy their own coverage are people who need it the most.